Welcome to Mad Medicine with Miss P. I have quite a few fun things from this week. It's been a little hectic, so I've got quite a bit for in a short period of time. And you can't make this up. And these are learning experiences. It's not just funny things people say. It's what it means when they say it, and how can we learn from it. For instance, the patient told me that she gets swelling in her legs, and it's a side effect of her blood pressure medication. Now, so here's the thing. We have to ask everybody, and I think I said this last time, that, whenever somebody comes in for surgery, you always ask them, do you have any lumps, bumps, bruises, marks, or swelling anywhere on your body we should be aware of, making sure that we don't do it, so we don't by mistakenly scratch them or, give them a shearing burn from the sheets or anything. I mean, I don't think we've ever done that, but, clip some skin in a side rail. You just make sure that, they didn't get it from you and any issues they had when they got there. So when we talk about swelling, I don't mean like chronic dependent pedal edema. I mean, like, is there any welt or something, anything on you that is suddenly swollen and wasn't there before, and it's acute, it's a new thing. So when this lady tells me that she gets swelling in her legs, but it's a side effect from her meds, probably, but not these meds. Her meds were Norvasc, spironolactone, and Lasix. Okay, so the reason you have swelling in your legs is most likely secondary to poor glomerular filtration. You have kidney disease. Now, I'm sure there's side effects that cause kidney damage from many of these medications, but your spironolactone and your Lasix are supposed to take care of that. So you have uncontrolled hypertension, or did for many years, and now you have renal failure. So you're on Norvasc, and your two diuretics are trying to get rid of the fluid in your legs because your vasculature and kidneys working together can't do it on their own because they're already damaged. But she thinks it's a side effect of her. Somebody must have told her that. So it's the same reason why I don't let my students write a bunch of ridiculous nursing considerations directly related to the disease process of the patient and why they're taking that medication. It doesn't make sense. So if someone's on metoprolol, this is the most common one I use. When a patient's on metoprolol, I don't let my students write in their nursing considerations. Those are things that as a nurse, we need to look for, we need to watch, we need to monitor, and, be aware immediately if something's going wrong fast. So the reason you don't listen for pulmonary edema for someone that's taking metoprolol, that's because not everybody on metoprolol has congestive heart failure. That's why you don't look for those things. And if your patient has those things, you suck and you're way too late. You missed it. You blew it. It happened a long time ago. They don't go from uncontrolled hypertension to massive pleural effusion and pleural edema inside their alveoli and a frothy cough or, crackles or something. That's you blew it. You missed that. That started a couple weeks ago, and you stopped it before it got to all of those things. Because if your patient has CHF and they happen to also be on metoprolol, you should be already looking for the first signs: a headache with uncontrolled hypertension, or a bout of hypertensive crisis. You should already be looking for those things. So if you let it go so far that they're already so fluid overloaded that they have a massive pleural effusion or pleural edema where it's actually inside their alveoli, you blew it. The doctor blew it. Anybody watching over this patient missed it a long time ago, because that doesn't happen overnight. That's why it doesn't make any sense. Those are not side effects. Those are conditions of the disease that is not being carefully monitored, or don't have that disease under control. That's the problem all the time. And I got a couple more examples of that later. And this happens also. I'm not sure how this works, but maybe because they're a little nervous about their surgery, and you should be. It's elective surgery. It's not something you have to have. So you're kind of thinking like, I'm doing this on purpose. What if something goes wrong? And, I chose to do this. I get it. But when you walk into the room and I tell you how to undress and what to put where, and, I kind of go through the whole thing, and I've learned to slow down. So those of you that want to bust on me because I speak quickly, I've slowed down. I even point to things, and, I tap on things to try to get their attention. And every single time, I would say maybe 8 out of 10 times, I tell them to their face, Also, because I don't want them to put anything on the side table. I literally say, have a seat at the foot of the bed facing that table. I'm going to slide it over to you because we have papers to sign every time. Then I come back, I set up, I pull the papers over to them, I get them all ready, and I'm like there for a few minutes getting everything set, and they're just sitting there, just sitting there, just sitting there, just sitting there. I put it all in front of them, hand them the pen, and then they turn to their spouse and say, honey, can you have my glasses? I gotta sign some papers. I told you like almost 20 minutes ago that you were gonna sign papers. You watch me walk the chart in, set it up to where you can reach it. I'm on the other side, it's facing you. Why are you waiting to the last second? I've got like 10 minutes to get you ready. Why do you not already have your glasses ready? I literally told you we're going to sign some papers. I don't, I don't understand every time. Another patient, this, oh God, I think this is all one lady. Crabby, mad at the world lady to begin with, and her cranky little husband. I bring them back, I get them ready now. In her defense, she did have some reason to be cranky. There, we had a machine that they couldn't get off the truck. The truck broke. It's totally out of our hands. It has nothing to do with us. It's somebody who brings a machine to us so we can use it for a specific procedure. And she did have to wait a really long time, but she was cranky before that. So she and her husband, I bring them back to a pre-op room. There's a bed, a cabinet, a bathroom, and a table on wheels, like a bedside hospital table. That's it. That's all that's in this tiny room. That's it. This is what they say to me. He turns to me, he says, do you have a place that I can wait where it's warmer? And also, you know, I don't want to be in here. I don't want to watch the surgery. You can go wait in the waiting room where you were, but we don't have like a special heated room for you to wait. And this is also not the operating room. There's not enough room for 2 more people to walk in here. It's not, I said, surgery is done in the operating room. And he went, oh. I don't understand when people think we're doing surgery in a small room that doesn't even, I mean, there's no anesthesia machine. There's nothing in there. What could people honestly think about surgery? Like, what goes through their mind when it comes to surgery? Like, I understand people don't understand anesthesia. They don't get it at all. They all think they're having a open heart surgery under local. But I mean, surely you've seen, like, I don't know, maybe enough ER, Grey's Anatomy, Scrubs to know that, like, there's a lot of machines and there's overhead lights and it's a larger room where other people can, you know, walk into. I don't understand that at all. It was painful, and she got crankier and crankier, but some of that I understand. Okay, so then this other guy brought back, usually sweet, and I guess his wife was a beautiful girl with this wild red hair. She was so pretty, and she wasn't a CRNA. It was like an SRNA or something. I don't even know necessarily what that was, but she was sitting over there, and she was really sweet. And I'm getting his blood pressure, and she said, oh, it's probably going to be high because you're nervous. And he goes, I'm not nervous. And I took it, and it was 147 over 107. And he goes, oh God, I guess I am nervous. All right. I'm going to explain this to you one more time. And then I'm going to explain it one more time, 10 more times. And I work with nurses and doctors that don't understand how this works. This is not rocket science. This is common sense. You don't need to be a doctor, a nurse, or a patient to understand how 146 over 107 is not nervousness. What are you, diastolically nervous? Is that what that is? That's diastole nervosa. I don't understand what you don't understand. If your blood pressure isn't being controlled by all of the mechanisms inside your body that usually control your blood pressure, then you have uncontrolled hypertension. You don't have to like it. You don't have to believe me, but none of that will make it less true, and I can prove it. Let's say sometimes I just get really pissed. When I'm really angry, I just lose my mind. I get really angry and just beat the shit out of the guy next to me. But it's only when I'm really angry. Otherwise, I'm a pleasure to be around. It's only sometimes. Is that okay? Like the example I always use, Only when my husband drinks, he comes home and beats the crap out of me, but only when he drinks. Otherwise, he's great. He's a fabulous husband. Does that sound just as stupid? So only when you're nervous, you're pressure cleaning the crap out of your kidneys and all of the delicate fibers of your vital organs and the capillaries, the tiny little capillaries that exploding under the pressure of a diastole of 107. So that's why I told him, I said, well, you can't be, systolically nervous and you can't be diastolically nervous. That's not the way it works. When both numbers are high, and 146 isn't necessarily high. If I took it again, I'd probably get something else, but I don't understand what people don't understand. Even the elderly, when they're 180 over 80, 160 over 60, 170 over 70, and they're like, oh gosh, I must be nervous. You're systolically nervous. I blood pressure is the easiest thing to understand in the entire body. It's the pressure inside your vessels all the time, your mean arterial pressure, right? It's the pressure inside your vessels at any given minute. The arbitrary high number and low number is kind of like the best it gets and worst it gets. So when they're both high, you have uncontrolled hypertension and it doesn't matter why. If that's what happens every time you get anxious, nervous, worried, upset, scared, or in pain, especially when you're here for an elective scheduled procedure, you have uncontrolled hypertension because you planned this. You got a ride here, you got time off work, you prepaid, you scheduled it, you went to see the doctor, you went to see the surgeon, you got the referrals, you talked to the insurance company, you know how much you owe, you moved money around, you came in with your credit card, you paid for it. This is something that is planned. What is your blood pressure when someone stops you in the middle of the night with a gun, or when you hear glass breaking and you're lying in bed at night? What happens? What's your blood pressure then? 300 over 200, and you just stroke out, so there's no point in them even coming in and murdering you because you're just going to die right then and there? That's not the way it works. Otherwise, soldiers would just be exploding left and right all over the field. I don't understand what you don't understand. Yes, blood pressure goes up when you're anxious, nervous, worried, upset, scared, or in pain, but how high does it go and how long does it stay? There's what tells you. And when this guy had absolutely no symptoms, I said, do you have a real bad headache right now? Any like blurred vision, dizziness, you feel, flushing, anything like that? He's like, no, I feel fine. Well, then your blood pressure's used to being that high. Otherwise, your body would tell you. And I kind of glanced over at her thinking, why don't you look into it? Clearly you're intelligent enough. Why don't you look into that and see if that doesn't make perfect sense? How high does your blood pressure have to be before you have a headache and you want to go to the emergency room and do something about it? How high? 107, your diastole is 107 and you don't feel anything? Yeah, it's 107 all the time. You don't check it. Start checking it. Start checking it and then you'll figure it out. Talking to you. I can't even. Are you nervous? Oh, well, I guess I was nervous. Okay, I can't. Oh, and this other lady, that same cranky lady, as I walk by, she screams, hey, hey. That's how she gets a hold of a nurse that's taking care of her. She screams, hey, like a 5-year-old that hasn't been smacked yet. She goes, I'm bored sitting here waiting in this room. Yeah, I am too, because as soon as you get out, I can bring the next patient in. And then when I get the last patient in, I get to go home. She's bored. You couldn't bring anything to keep you busy? I don't understand. Well, I can go get a magazine for you. Yeah, and as I explained the truck broke and I explained the whole thing. And I said, make sure you tell your doctor how upset you are with the weight. Do you think she said one word? One word to her doctor? Not one word, ever. Oh, this was the same, and I told you I had a lot of stuff on this more. This was the same idiot who the receptionist hands them a 3x5, like bright pink card. And she says to them, put your driver's name and their phone number on it. This lady wrote down her first and last name. She wrote down her Aetna number, her driver's license number, her name and address, her phone number. So much so to where I had to throw it away and get another one and just put Ronnie and a phone number on it. It's not that difficult to listen when people talk. And then she's all mad that, she thinks she's not being listened to. How does it feel? I don't understand what you don't understand. Listen when people speak to you, pay attention to the words they're saying, and then do what you're told, and then you won't have that problem. When I told you the truck broke, we have no control over it. That means the truck broke and we have no control over it. You see me still here. It's not like I'm off to bigger and better things. I'm waiting also. She was a joy. Oh, as I was doing a block on another patient, one of my coworkers who I love, she is hilarious. I heard her repeat this over and over and over, and she's looking over at me and she's saying it out loud. And she's looking over at me, and I was like, that's it. I came over, I gave her the paper in my pocket that had all this other stuff written on, and I said, you have to write it down. This patient says she can't take oxycodone. make sure you do not give her any oxycodone. That's not even combo of 2 meds. That's 3 or 4 meds. I don't know. Oh, and then I was talking to this guy on the phone, and he was sweet, but he drove me a little crazy. I said, you know, how tall are you? And he told me. I said, okay, and how much do you weigh? And he goes, I have no idea. I'm like, you don't have a little bit of a clue, not even sort of. I have no idea how much she weighs. How much who weighs? My wife. Sir, I don't care how much your wife weighs. I just asked you, are you 5'8"? Yeah, I'm 5'8". Well, then I asked, how much do you weigh? Oh, hold on, let me get a scale. The rest of this little CHF mess, I'm gonna save for next time because it was that much fun. You guys, I'm not gonna make it. I need to crochet and sell stuff at a market down the street. Then I'll probably have even more fun people come up and say, "Oh, do you have any of these other ones?" And I'll say, "Well, do you see them? You can't, here's your sign. That's who is that, Bill Engvall? That's a real thing. Face your fears, forget your failures, follow your faith. Love you."